Since the next phase of the nursing process is planning, we will look at planning questions next. Remember that during the planning phase, the nurse must develop and modify nursing care plans and set goals for meeting the client's needs and designing strategies to meet those goals based on the nursing problems or diagnoses identified. Therefore, planning questions require you to analyze a situation and apply knowledge to plan client care. When answering planning questions, keep in mind that they usually include some form of the word plan or prepare. Remember that your plan must relate to the issue of the question, and many planning questions require prioritization skills, and that the answer should involve something that is included in the client's nursing plan of care rather than the medical plan of care. This exam is about nursing, so always first focus on planning the client's nursing needs. Let's look at an example of a planning question. Let's go ahead and separate the case scenario from the stem of the question. The case scenario tells us that the nurse writes a plan of care for a client who is recovering from a craniotomy for a pituitary tumor. The stem of the question asks us, the nurse assigns the highest priority to which diagnosis? Risk 4. Let's identify the critical elements. The key words are highest priority. The client is the client who is recovering from a craniotomy for a pituitary tumor. The issue is the priority nursing diagnosis after a craniotomy. The type of stem is a priority response stem. Go ahead and look at and eliminate distractors. Like many questions about the planning phase of the nursing process, this is a good example of a priority question, which, by looking at all of the options, they may appear to be all correct. We will assign question marks to all of them and then decide which assessment finding is highest priority. Let's begin with option 1, fluid volume deficit. We will assign this a plus sign. We know that after a serious complication following this type of surgery for a pituitary tumor is diabetes insipidus. An early manifestation of DI is extremely elevated urinary output, which can quickly lead to fluid volume deficit and hypovolemia. This is a potential that the nurse will be very concerned about. Even so, let's see if there is a nursing diagnosis which takes higher priority. Option 2, constipation. Although this is not a normal finding, neither is it very unusual in a client recovering from major surgery. Remember that anesthesia, prolonged periods of NPO, decreased activity, all tend to slow down the peristalsis in the bowel. Let's see if there is a better nursing diagnosis with a higher priority. Option 3, body image disturbance. Although this is not a normal finding, neither is it very usual in a patient recovering from either facial or cranial surgery. Remember that the inflammatory process will tend to encourage edema, such as around the eyes and ears. The large head dressing is disturbing, and it is also likely that the client had some amount of hair shaved from the scalp. Further, some transient deficits may be related to edema of the brain tissue. Even so, we should see if there's a nursing diagnosis with a higher priority. Option 4, sensory perceptual alteration. Remember that the inflammatory response will tend to encourage edema, periorbital edema, and around the ears. Further, some transient loss may be related to edema of the brain tissue. This may or may not be the highest priority. Because we have 3 possibly right answers and 1 probably right answer, choice 1, we go with what we know and choose 1, fluid volume deficit, as the correct answer. Now, let's look at the next phase of the nursing process known as implementation.